Hopefully everyone can see those.
Yes.
Great, thank you. Okay, so for today's agenda for our March webinar, we have a series of presentations. We're going to start by hearing from our colleague Daniel Kobos again, excuse me, around how to implement the situational assessment tools so that we presented on last month's webinar. And so this is going to be an opportunity to kind of dive further into each tool, and we will have time for questions and discussion around what these tools can do for you or how to adapt them or what experiences people have had. And so following Daniel's presentation, then I'll ask those of you who have joined this call for some feedback on kind of how your situational assessments are currently going, so we can hear from you, and as well as the other, so everyone can hear kind of where each team is at and what their experiences have been like. We'll follow that up with two short presentations, or potentially just one, at least from Dr. Faza, on her team's experience with setting up governance structures as part of the SRS planning activities. And so she has a short presentation that I think will be really helpful and give good insight into just seeing how some teams are approaching developing these types of structures, the intensity and the number of stakeholders involved, all of it. And so hopefully we'll also have time for questions then. And then towards the end, we'll have a quick presentation from Fred and Emma on two new websites that you all should be well aware of on GitHub and YouTube, and where you can find resources moving forward. And then I'll wrap us up with next steps. Please, just as a shout out, we want to keep hearing from you on what topics would be most relevant to cover on these webinars. So please feel free to either put your suggestions in the chat or just reach out to me, Samantha Dolan, directly, and we can go from there. So this really is supposed to be a time that we're using in a way that is going to be helpful for you all. So just please let us know what you prefer. All right, without further ado, I'm going to pass it over to Daniel, and he's going to take it away with a deep dive into the situational assessment tools.
Okay, hi everyone. Just checking that you can hear me.
Yes, we can.
Yes. Okay. Hi everyone. Hi. Thank you. So, well, thank you for joining the meeting. As Sam was mentioning, the idea of this session is to dive a bit deeper into the situational assessment that hopefully you are already underway and you are using and implementing. And the idea of this session is to discuss a bit like what is expected, or what do we think that would be useful for you from the situational assessment to inform your planning and design of your SRS implementation. So the idea is, okay, what do we think that would be useful from the assessment that will be helpful for you in your discussions, in developing the protocol and the costed action plan. So what we have in the screen now is what we have in the document as the objective of the assessment. So the assessment seeks to understand existing systems and platforms and mortality data collection and use, their functioning, interoperation, stakeholders, and how they can contribute to the development and sustainability of the sample registration system for mortality and cause of death in the country. So this is the assessment, and if you can click the next slide. So we like just to unpack a bit what that objective for the assessment is. So first is we want to understand which system exists and what platforms are collecting mortality data. Mortality meaning fact of death and cause of death data. Second, in green, we want to understand like how they are functioning, how they connect to each other, how they are not connected to each other, how they interoperate. And third, we want to understand the stakeholders that are involved in the mortality ecosystem in the country to see how the SRS will fit into that space. So these are kind of the three key elements that we thought that would be useful during your situational assessment. And underlying there is that all of this is targeting the design of the sample registration system, because we can be lost in massive analysis, in-depth analysis of the mortality system in the country, which is probably an interesting thing to do. But for the purposes of these activities, is really focused on SRS, how the SRS implementation will be anchored in the system. So if you click next, so then for each of them, for each of those kind of it's pieces of information that should come in the from the assessment, we have developed the forms and the tools that we presented last month. So, for example, to understand the existing systems and platforms, you have Form 1.1 and Form 1.5.1 that is looking at the inventory of system collective mortality, and also an Excel file that can help you develop your information architecture. When looking at how these different systems are connected or disconnected, who is doing what, this is more related to the green side, and you see there Form 1.5 on information architecture, sorry, and then Form 1.6 on business process mapping. So these are two tools that you can also use to understand how your mortality systems are connected or disconnected. And then for the stakeholders, you have three forms, Form 1.2, 1.3, and 1.4, that are looking at mapping out who is who, what are the governance mechanisms, and then doing this power grid analysis that we propose. So you see that the forms and the tools that you have in the folder are linked to each of these elements in the situational assessment. If you go to the next. So when we look at to understand like which systems, sorry, let me get me out of the way. Yes, sir. So on the first side, like what existing systems and platform exist. So we want to know which IT solutions or paper-based systems are recording, transmitting, or producing statistics about fact and the cause of death. And there you will see Form 1.1 is what you see on the screen is basically a table where you have for each of the systems some characteristics that we thought would be useful to you to document. And if you click next. Yeah, that one. So and what you see in the bottom line is a more in-depth analysis of each subsystem. This is an Excel file. It's called Form 1.5.1, and this is an Excel file that has similar information to the one that you see at the top. But then you can also dive into, for example, who is sending information to whom, which systems are connected, which data elements are being collected in the different forms. So you can go much more in depth into understanding the subsystems collecting mortality data in the country. So these are two kind of forms that you can use and adapt, or you can use them as they are or adapt them to your needs. But you can go either as a more like high level overview of which systems are there, or a more in-depth analysis of what mortality systems exist in the country and how SRS can be connected to them or should be connected to them. If you go to the next. Sorry, there's So then when we're looking at how the systems, the different subsystems are connected or disconnected, we propose two different methods. One is process mapping, that is the one at the top, and then the one at the bottom is we call it information architecture, but it's kind of an evolution of social network analysis. But anyway, these two different methods will help you understand how the information flows through the system currently, and how the SRS implementation will connect to that information flow. Because at the end of the day, we want the SRS implementation not only to generate fantastic data, but also that also contributes to the mortality data ecosystem in the country. So to do that, we need to understand what information is being generated, how it's being generated, and then how SRS will complement that picture. Those two methods are described into two different, we call it forms, but it's like approaches, and you have the description of how to do it and references, and it's not rocket science. So these are simple methods that can be used. And if you need like support implementing them or analyzing the data that you have, you just need to reach out, and we will definitely help you in the different steps of developing this. So with this, hopefully at the end of these methods, you will understand who is collecting what information, how the information flows, and then that will inform how the SRS should be designed. If you go to the next. And then finally, when it comes to stakeholders, also, again, the SRS implementation is not a standalone activity that will be done in the country. It needs to be integrated somehow in the CRBS system and the mortality ecosystem of the country. So we really we think that you need to know, or it would be useful to know, what are the governance mechanisms that exist, who is who should be involved at which stage of the planning or implementation of the SRS. So there are like this governance and stakeholder analysis, we think is super important to bring everyone on board so that the SRS is not only sustainable financially, but also is accepted and the statistics are used at the end. So we propose two different methods or tools that you can use. One is more kind of a questionnaire-based type of analysis where you would what we propose that you could go to key informants and do short interviews to understand like what is their role, what do they do in the mortality ecosystem, and how they would see an SRS being implemented there. And then another method that we propose to you is more a participatory activity with multiple stakeholders in one place, probably, where you try to map out not only who is who and who is doing what, but also how they could be linked to the SRS in terms of power or interest in the SRS implementation. So this is, again, if you need support with how to implement the survey or the key informant interviews, or how to analyze the data, or how to facilitate a participatory activity to understand who is who, we can support with that. But these are you will find two documents describing what we propose, and we are more than happy to engage with you in further discussions if you need support. And I think this is all from my side. If you click, yes. So just to wrap up, so the idea of very quickly is to bring you back again to the assessment tools and methods that we propose. They are just proposed, so you can adapt them, you can use them or not. But ideally, you would go through some of these questions in a structured and systematic way, so that at the end you can properly inform the action, the concept action plan for the SRS implementation. And I think that's all from my side. Thank you, Sam. Over to you.
Thank you, Daniel. I just want to see if anyone has any questions for Daniel on any of those worksheets that he just covered and kind of the intended uses. Rahel, please go ahead.
Thank you, Sam. My apologies, I joined late, so I'm sorry if this was already covered. But on the digital tool assessment, there was the column that said geographic scope, and it was national, subnational. And I was wondering if that would also capture information on how far the rollout has gotten to. One of the issues that we've seen when we did a surveillance landscape assessment and associated with that, a digital tools assessment for a separate project was, even though some of these digital tools are supposed to be used nationally, their rollout is still in the very early stages, to the point that you won't actually be able to use the data for decision making. So I was just wondering where we can capture that information in terms of, how far we've gotten in terms of rollout, if it's just, a few provinces across the country that are actually using it, and even though the geographic scope is meant to be national. Thank you.
Thanks, Rahel. Daniel, do you want to go ahead?
Yes, thank you. Thank you for the question. And actually, we at least in the tool that you see at the bottom in the Excel one, we added that because we realized what you have just described, that many tools are meant to be national, but then the implementation is really either they are in the pilot phase or they are just focused on some provinces. I definitely think that that's something that should be captured, and then you can differentiate like between the geographic scope, like the intended one and the actual one. Also in the process, in the business process mapping, we also do that. We differentiate between what was supposed to be and what is actually is in real life, because we want to capture both. We want to know what is the plan maybe for the future, but then what is actually now, so that we can really inform the SRS design. So either you, in the form 1.1, you can add more columns, or you can maybe dive a bit into the Excel file that has more granularity on more questions on scope and the promises or subnational areas that are covered by the system is one of the variables that we capture actually in the Excel file.
Great, thank you.
Thanks. All right, Ronald, I see your hand up. Please go ahead.
Yeah, okay, Samantha, just a quick one. In Form 151 we have on the scheme now, on the scheme screen now, I noticed that you got name of mother, but there's no name of father. I was wondering why, because in low and middle income countries, especially in Africa, the societies are largely patriarchal or male dominant. So why are fathers data not captured?
Yeah, thank you for the question. And this is just an example, and this is a template for you to modify. So definitely, if name of the father or any other data element is relevant and important, please put it there. The idea of when we used this in other countries, I think it's important to identify the minimum essential data elements that you want to capture, and then other ones that are desirable, because this is a time-consuming activity. So you probably want to see, okay, for the SRS implementation, what are the data elements that are interesting for me to capture the flow, and then go back to the forms and to the different subsystems to see, okay, where this information is being collected and how can this get to the SRS implementation at some point. But you can adapt this. So these tools are all for you to adapt, to change, to modify, and we would be happy to support with that as well. But please feel free to change them. They are for you.
Thanks, Daniel. Robert, please go ahead.
Thank you very much. Thanks, Daniel, for presenting this one. I think these tools are really useful for situational analysis and all that. But I'm just wondering, how far can one go, or can country go in this situation analysis without having to overburden the implementation itself of SRS? Because as you go through the planning and engaging stakeholders and everyone, they all have something that they would like to contribute, but also to get information out of the SRS system. So I'm just curious about resources, and especially if you're talking about sustainability of this SRS activity beyond the implementation where it gets donor funding. So I'm just curious whether at the end of the day, how does this information help in the implementation of SRS itself, not just the planning? I think knowing what's happening there is good, but how much can SRS take? Because definitely, once you engage the stakeholders, everyone will want a piece of to get information from that system. But there's only so far that one can go without having to overburden and then end up having a more complex system that is highly expensive. And then at the end of the day, sustainability becomes an issue. Thank you.
Robert, I think that's a really good question. And Daniel, I'm going to give you 2 seconds to respond to it. But I think we also, after this, have our country, we want to get feedback from our country teams on that question as well. So maybe we can hear from all of you on how you feel about Robert's question. But Daniel, please go ahead.
Yes, very quickly. I think it's a super good point, Robert, and I think it's partly capturing one of the tools, but because one of the exercises that I think would be interesting is what the different stakeholders will need from the SRS, and what can the SRS provide, and get into an agreement in this balance between what the SRS could provide, and then what would be interesting for stakeholders to have. But having a map of what stakeholders want to get out of the SRS, I think is would be super interesting. We can actually work on a small form that to capture that. I think that would be super interesting.
Thanks, Daniel. All right, with that, I'm going to move us along a little bit, but just to stay on the same topic. I think just given that I hope our colleagues from Tanzania and Pakistan will give us some short presentations after this, I'm going to ask the other teams, so Mali, Ghana, Kenya, and Senegal, if you have some experiences about your planning exercises that you've conducted so far for the SRS situational assessment. If you can just give us a little readout on how that's going, how you're feeling about it, and if you have any feedback on the assessment tools. And I think we can add in there Robert's question about how you feel about the transition of the collection of the situational assessment data and what that will really mean at the end for the actual SRS implementation and how to work with stakeholders to set expectations for what the SRS can actually accomplish versus what they might be excited about. So with that, Jason, I'm going to pick on you just because I know you're ready to go.
Sure. Hi, everyone. So Sam, I had prepared some slides. I don't know if we have time to like really switch over. But what I wanted to really go through is how useful the tools for developing kind of an organogram or governance structure has been, and really understanding who the players are, how the hierarchies are fit together, and then if you're able to, I guess, have it all in front of you, where the different, I guess, the personnel that are going to be doing different jobs and things like that. So it's like so nice to have everything out in front of you. And so that was very, very helpful. But I really want to emphasize the usefulness of the stakeholder mapping exercise, and that we started when we were over in Zambia. That we had put together our map, just as you had presented a couple minutes ago, in mapping all of the kind of key players in developing. Sorry, it's asking me to confirm my language. I don't know if is the translation working well, or
I think it,
okay, okay, okay. Thank you. Sorry about that. So Sam, I don't know if you wanted me to share my slides. I don't know if we have time for that, but
yeah, I think we have a little bit of time. I'll stop sharing if you want to go ahead.
sure. Please let me know. And I'm going to skip a couple slides just to kind of go through this. Actually, I need to give a shout out to Instat.
And Jason, maybe just to clarify, you are representing the team from Mali.
That's correct. Yes, absolutely.
Okay.
Okay, let me know when you can see.
Yep, looks great.
Excellent. So what I wanted to present first and foremost is kind of a Christmas present that we got last year when we were doing this planning. We in doing another effort, another Gates Foundation effort with the Malian government, we aligned ourselves with INSTAT, which is the National Statistics Institute. I'm not going to try to say that in French because that would be offensive. And so that's a government agency that's responsible for collecting and analyzing, cleaning and maintaining census and public health data and many other things. And so we were able to kind of align with this team that has a vast plethora of experience, a workforce, and everything in order to then connect us to what I'm going to go through very, very briefly now. And so we, as you can see, this is a stakeholder map. This was programmed in R. If anyone wants my code, I can easily send it over to you. It's very, very simple. You kind of put in the to and the from entities, and they go, and then it develops this map nicely for you. So what we've done here is with the deputy director general, we were able to brainstorm and map all of the key players within public health and mortality surveillance and reporting. And so we were able to construct this map here. And we have noticed that there are 3 different entities. You've got your government organizations here, and there are a lot that are involved with health and mortality data. And you can see here, INSTAT is in bold here. And then at the end, the Ministry of Territorial Administration and Decentralization, they also conduct CRVS activities. So we are very, very interested in getting them to the table to understand what they're doing and how we can integrate our efforts, so we're not duplicating efforts. So the next, I'm not going to go through this. The next stage was looking at the international NGOs and partners. And you can see there's a list here. And then what we were surprised at was there was also a very important in our country context that community and informal reporting systems are very, very important. And I will make a note of this. Using with the help of INSTAT and is using satellite data, the INSTAT team has been mapping and identifying 90% of the Malian population, and we've been discovering communities that we've been calling zero dose clusters, or these populations are very, very far away from any sort of formal medical facility and have never benefited from an external public health intervention. And so we're able to identify these communities who don't have formal systems developed. And so then we have to kind of go down to the communities and see how they are recording their mortality, pregnancy histories, things like that. And that includes your police and the imams. So that's something very, very important in the Malian context. And so I don't necessarily need to go through this unless, Sam, you want me to, but the next step is to color code that a stakeholder map with this power interest matrix and identify if there are any clusters that we need to kind of prioritize and get together in the same room at the same time to have these conversations, so we can kind of merge a lot of these meetings in appropriate clusters. So that's all I prepared. I skipped a bunch of stuff, but so basically the tools have been extremely helpful, and these tools have been extremely helpful. So thank you.
Well, thanks, Jason, and appreciate you preparing these slides. You have one question in the chat around what does PTF mean?
Yes. So a lot of these are in French. And so let's see, where is it?
PTF means Partenaire Technique et Financier.
Yeah, right. So
technical and financial partners.
Mm-hmm.
Thank you, Jason. Thank you, Sam. Thank you all.
Thanks, Jeff.
All right, I'm gonna move us along, but if you have other questions for Jason, please feel free to put them in the chat. I want to see if any other team wants to volunteer. You don't need to have slides, but if you want to just share briefly your experiences with the situational assessment tools, we'd appreciate hearing from you. I can't see everyone's name on the call, but so I apologize. I know you all, but I know every team has experience, so so if you do want to chime up, that'd be great. All right, I'm not seeing any hands, so I'm going to move us along, but we can come back to this because we have a presentation from our colleagues in Pakistan around their experiences that I think will also be very informative. And then again, we can move on and see if anyone else wants to share. So with that being said, Dr. Faiza, please join us. I'm going to share your slides shortly.
Thank you. Good morning, good afternoon, and good evening, everybody. Whatever fits you all. Yeah,
Wait, there
Sam,
we go.
thank you. Yeah. So this is Faiza Bashir, and I represent Team Pakistan, and we are currently going through our situational assessment phase of SRS planning. Next. Okay. So briefly about Pakistan, we are 240 million people's nation, fifth most populous country on the earth, with life expectancy of 65 to 67 years, and crude death rate is 7.2 per 1,000 population. And we are currently almost highest ranking in our infant mortality and maternal mortality ratio. And 9% of our newly born children go unregistered, which accounts for almost 50% of global unregistered children in 2019 estimates. So besides this, our death registration is also very low, and there's no formal mechanism to hold on, I just have to, okay. So there's no formal mechanism currently in place for vital statistics registration system, although we are in a phase where country is preparing to launch one, but we are not there yet. So this is the background that we started our SRS activity. Next, I'm unable to do this, Sam. Okay. So currently, as I said earlier, we've had multiple efforts from donors and partners for a comprehensive system, but it failed owing to multiple reasons, because we have huge population with vast geographical distribution as well. We have, of course, LMIC, so resource constraint and commitment issues are also there. And one of the most important factor that we also realized during our situational assessment is that there's perceived utility is very low with regards to when it comes to the death registration, because even in the health sector when we went there, so everybody was asking, why are you counting those who are dying, those who are dead, so what is your purpose? So this comment coming from the health sector actually tells you how much we are lacking in perceiving the utility of this information. And available data sources are mostly facility based, such as IDSRS systems. So they are not covering the communities, and a majority of deaths, because of our cultural reasons as well, and owing to the lack of access to the healthcare facilities, are occurring at home. So they are mostly they remain unknown. That was the reason we planned the SRS. And next. So our aims were to do the situational assessment, and while doing so, we also wanted to engage with the stakeholders, which we are currently doing. And we wanted to develop and iterate the process map, because there are many planning exercises that already happened in Pakistan for developing the CRVS and other mortalities of and other vital registration system activities. So we wanted to have a proof of concept as well in our planning activity. So we are also preparing for that side by side along with the situational assessment. We are also assessing the feasibility of doing a proof of concept study, and at the end of that, we want to develop a costed implementation plan for all across Pakistan. Next. So broadly, our methodology would be the scoping review and stakeholders mapping, SRS tools finalization, doing the RACI agreements during our initial stakeholders meeting, pilot testing and dissemination of that initial results of the testing, and cost and implementation plan, which then goes to the ministry for final approval and dissemination. Next. So our strategy is to, engage with our because successful implementation, we definitely got this from our initial exercise, that it heavily depends upon engaging with the right stakeholders. There are many stakeholders in Pakistan, because over last 75 years we've had multiple exercises, and multiple systems are already there. Some of them are state of the art IT systems, but we have to choose between the right stakeholders who really the power and interest matrix that's going to be really effective for at the end of our situational assessment. And there has to be a synergy between various governing systems, because health in Pakistan is a devolved subject, and also this mandate is actually distributed all across Pakistan. So synergy between various governing systems is very important. And in field, we have a lot of activities going on, which does not essentially capture the mortality, but it certainly has a component of mortality, like periodic surveys, DHIS, PDHS, planning activities of civil registration of vital events. Ministry of Health has integrated disease surveillance and response unit, which is now planning to capture the mortality as well. So, and local governments also have their systems in place to capture whatever voluntarily people are coming for their registrations, and HMIS and electronic health records in private sector, because largely the health system in Pakistan actually is under the private sector. So that also has to get engaged. So next. So, understanding the governance system of Pakistan was too complex. And for that, we also felt the need of, having the right governance system for SRS model as well, because we had to chip in a lot of different fields, a lot of different ministries. So we also decided to have a governance system at the SRS model level as well. So first of all, we have created a national steering committee, which actually has all the provincial stakeholders involved, and all the higher hierarchy people like secretaries and ministers to be a part of the national steering committee. Alongside that, we are going to have national technical working group and international advisory panel to guide us through the secretariat, which is going to be within NIH, where we belong to, and then we are also having core committees, implementation team, analysis team, and VA team, and cause of death team. So this is the governance system. This is the governance model that we are also testing alongside our situational assessment. That if it works, we are going to also offer this solution to the provinces in the implementation phase. So next. This is all the same that I already repeated. Next. The next. So currently we are conducting our situational assessment. We have 4 provinces and 3 regions, and we have covered 4 provinces and 2 regions. One of the region that is Gilgit-Baltistan is left because of the weather. The flights were not available, so we have not been able to go there, and there was a lot of landsliding going on. So we um, we uh, we thought it's better to wait for a month. And process mapping is almost complete. Other than our Gilgit Baltistan, the tools are being finalized and MOUs are in process of we have shared the draft, so they're in the process of getting signed. So next. So from our situational assessment, I'm not going to go into the details what we are having because of time constraint, but we have seen that it is not purely a matter of health, but it is heavily dependent upon health. So within the health, there are multiple platforms that need to be explored, like directorates of health, disease surveillance units, lady health worker programs, the private sector in terms of which goes under the healthcare commissions, maternal neonatal child health system, and there are multiple information systems in Pakistan working very closely with the health sector. So that's the health component that we are aiming to in getting engaged with. And there are other agencies and administration, particularly the National Database for Registration and Bureau of Statistics, the graveyard people, because there are many communities that have no access or very poor access to the healthcare system, so their information is not at all being reported in any kind of healthcare establishment. So these are very, very essential components of our data with regards to death notification and causes of deaths. And ambulatory services, we have a huge network of ambulatory services, philanthropically driven. So these also have to be accounted for, and there are cantonments. Cantonments are as big as our cities. So we've also engaged with them, although it's very difficult to get information out of those cantonments, but certainly these account very important data aspects. And then there are many partner organizations in like WHO, UKHSA, CDC, and Integral Global, and others who are already working in these sectors. So we didn't know previously that they were also looking into the aspects of mortality somehow or the other, particularly infant and maternal and neonatal child health. So they were also looking into the mortality. So we are going to engage with them as well. So multiple partners have been explored, and there are many more coming up. Next. So our overall impression with the situational assessment is that although the reporting is very limited, and there are multiple factors, there are religious factors, there are access issues, there are regions which are affected by the conflict or political instability. So continuity of the data, reporting of the data is also a huge factor. So making it challenging for any health system to work consistently across the whole year. So these were overall impressions. Next. So our challenges are that we do not have any legal framework for mandatory reporting of vital statistics. Vital statistics are being reported on voluntary basis. If somebody needs to get the death certificate, only then they go for the certificate for inheritance or the other legal purposes. Then they go for the registration of the deaths. And the acceptability of the new system like CRVS, like mortality surveillance and everything, like I said earlier, that even the health people were saying, why are you asking for those who've already died? We have a lot of people who are living with disease and disability. So why, you're going after the deaths? So acceptability of this system is really challenging. And we also have infrastructure issues like all the LMICs, and people are not ready for integration. They are working in silos. So this is a huge, huge challenge for us. And there are also partners pull, whenever you are working in LMICs and there are partners also working. So our priorities are aligned with the partners' asks. So there are many things that should be happening, but they're not happening because partners are not interested in that. So that's also one of the challenging factor out there. So next. So of whatever the information that we've collected, we collected actually the information much before we got these tools. But when we are now, trying to, in the meantime that we are going to go to the last region, we tried to put whatever the information that was available to us in the situational assessment tools that you people have shared with us. So uh, we are glad to announce that majority of the information has already been collected, and we have also mapped the process that's happening. So next. So these are two of the process maps. These are only the examples of how the system is working. So it's very pretty simple looking here, but there are many more complex things that are coming up in future. So we tried to follow your Daniel's lecture. So this is one of the illustrations of that. Next. So, from our situational assessment till now, we have seen that we have to address our cultural barriers. If we are to make this successful, we have to invest a lot in community engagement, and also the existing infrastructure that is already available. It's not that we do not have the infrastructure, we do not have the IT infrastructure. We have everything, but just putting all of these together is the only task probably. And that actually also gives us a hope that this system is going to be sustainable if it is put in the right in the right manner. So data analysis capabilities definitely we have to enhance. And we've also learned that our SRS is extremely incomplete because if we do not have a graveyard surveillance. So in Pakistan, graveyards are major source of death notifications. If we are able to include them in SRS activities, we are going to save a lot of money, and a lot of automation of the death notification is definitely coming from the graveyard surveillance. And also create the synergies that I already informed before. So that's all that we have till now. Thank you very much. If anybody has a question.
Thank you so much, Faiza. That was great. And really, I think we could have spent like easily 5-10 minutes on each slide there because there's so much information. So far, you have one question in the chat, just on the SRS National Steering Committee. Who chairs that committee?
Okay, so it's the Secretary, Federal Ministry of Health.
Great. Thank you. And then Ronald, I see your hand up. Please go ahead.
Okay, thank you very much. Thank you for the presentation. It was really exciting. It had a lot of information. I just wanted to refer to the slide that has the steering committee all the way to the implementation team. I know when we talk about the people working,
Yeah.
I mean, you've got the leadership team and the implementation team. Of course, you did very well in opening up the leadership team very well. Now, regarding the implementation team, I realized that you factored out the VA team and cause of death team. I expect the VA team and COD team to be part of the implementation team? Because you have the surveyors in there, and they are the ones doing the global autopsy. You've got physicians doing the cause of death, the information. Otherwise, you wouldn't have information for the analysis team. So I was wondering why you factored out the VA team out of the implementation team. Is it for a higher relevance?
Oh, thank you so much for asking this question. It's not actually the VA team, actually the implementation side. It's actually the the panel of experts team that is going to, be deciding upon the cause of death based on the VAs that implementation team is going to give.
Oh, okay, okay. So
Yeah, the panel of experts, yes.
it needs to be renamed then. Okay, thank you.
Oh, yeah, I have to change this. So thank you.
Yeah.
Thanks, Ronald. All right, Daniel, do you want to say your question in the chat?
Yeah, thank you. It was a question on like how, because you're generating super interesting information, but then I was wondering like how are you gonna bring all of that to the stakeholders and if you have already a plan to bring a series of meetings at the National Steering Committee or whatnot, like how are you gonna bring people on board to understand what your assessment is telling you and then to move forward?
Thank you, Daniel, for this question. Yes, of course. We have a series of meetings. Currently, we are doing the situational assessment, and side by side, we are also sensitizing each of the stakeholder individually. But then, at the end of the situational assessment, when we are ready with our results from all across the country, we are going to conduct the nationwide exercises, all of the stakeholders at one place for not only once. Before we draft an before we draft a proof of concept study, and after we are done with the proof of concept, and even between that as well. So there are multiple, and there's not only going to be the National Steering Committee meeting, it's going to be each, National Technical Working Group meeting as well, and international advisory panels alongside this National Technical Working Group, so that everybody is on board. We did not do it intentionally in the start because we thought that we go, we learn the situation, whatever is happening, and we come back and we draw all the things that's happening there, and then we present each of the stakeholder at one time that look what this is the system currently happening in Pakistan. So, and this is the need. How to chip in, how to plug the different systems work in Pakistan. So we have planned different, multiple such activities, but they are also coming up in our April, May, and June. So yes.
Okay, thanks.
All right, thank you. Okay, I don't see any other questions, so I'm going to move us along. But with that being said, this is now, we have about, I would say, 5 minutes to open it up to anyone else who wants to share their experiences. I see that we have representatives from the teams from Tanzania. I think I saw Dr. Masanja on the call,
Yes,
Ghana, as well as Kenya. Does anyone want to come off mute and talk about
So,
their either governance or situational assessment experiences?
Samantha, this is Masanja.
Oh, Dr. Masanja, there you are. Please go ahead.
So, Mrema will put us the presentation. We have a few slides to share about
Oh,
the
great.
initial.
Yeah, I'll stop sharing. Please go ahead.
Mrema, go ahead.
Thank you. Yes, can you see my slides?
Now we can, yes. If you want to just put them in presentation mode.
Yes, so we have 2 slides trying to explain our experiences from Tanzania regarding the stakeholders engagement meeting, but particularly on how we try to understand the governance on SRI implementation.
Can I just interrupt for 1 second? Do you mind coming closer to the microphone? It's a little bit hard to hear you right now.
Yes, can you hear me?
A little bit closer.
Yes, so I'll try to speak louder.
There we go. Okay.
Yes, so we have we had a stakeholders meeting, try to understand first of all stakeholders in mortality surveillance system in Tanzania, but also to understand the governance structure. So we held a stakeholders meeting as one of the activities in the 12 steps in the planning.
I'm so sorry to interrupt again. Do you mind putting your slides in presentation mode? We're seeing them, just the PowerPoint slide file.
Yes, so first of all, we identify all key players in mortality surveillance. And
sorry, we're not seeing the slides if you're changing them.
Can you see my first slide now? It's about the roles of each partner.
No, we can't see that.
Slideshow.
Mrema, can you send the slides to Samantha, maybe, if you cannot change them?
Yes, I can do that.
There we go. But if you want to put them in slideshow mode, then it'll be bigger.
Yes, so this is slideshow.
You must have another screen because we're not seeing it in slideshow mode.
And maybe what I can explain while I'm looking slideshow. Yes, so we have a number of partners that we identified, and also we try to discuss, but also to identify their roles. The first one is it's called RITA, which is the main role is to document all vital events that happen in the country, but also the registration of deaths. So this is their big role. Also, we have the Ministry of Health, and their main task is to assign the causes from deaths that happen in the health facilities, but also from the community. We also identify the President's Office, Regional Administration and Local Governance Government Ministry. This ministry manages all local government staff, and in SRS we plan to use the current systems. And then this ministry is key because all implementers, all staff that will be used in data collection in SRS will come from this ministry. So this ministry will be, the key role for this ministry will be like implementer of all related mortality activities at the lower levels. We have also the Ministry of Home Affairs. This will be, its main role will be to assign the causes of death, especially for those deaths that happen suddenly or suspicious deaths. So this ministry also is key in SRS planning, but also implementation. We have also a group of implementing partners, and their key role will be for providing technical advice. And among them are Vital Strategies, CDC Africa, and UNICEF. And IHI, or Pakistan Health Institutes, will lead the technical coordination of the SRS planning, but also implementation. We have the Prime Minister's Office. Of course, this will be we will be coordinating the high level of CRBS and Mortality Surveillance Steering Committee in the country. And also we'll have a National Bureau of Statistics, and their key role will be to provide guidance on the production of mortality statistics in the country. So these are the roles, but also the key partners in the implementation of SRS planning, but also during the implementation. So in this meeting, we went further by giving the opportunities of each stakeholder to present what they're currently doing regarding on mortality issues. Then so far, or currently, the Ministry of Health is, of course, is doing the assessment of causes of death on all deaths that occur in health facilities, but also conducting development autopsy at the national representative sample, and also have this integrated diseases surveillance and response. We have the RITA, which is responsible for the registration of all vital events, specific, and which also include deaths. We have the National Bureau of Statistics that is used to conduct population and housing census, surveys. And we have the Ministry of Home Affairs dealing with medical legal death investigation. We also discussed about the indicators that is collected from those institutions or organizations. Then, of course, they identify 4 domains of indicators that are currently collected, but also they suggested to be collected during the SRS. And then, so you can see we have the mortality in the household and health indicators. We have the causes of death indicators, mobility indicators in the household and population indicators. They also reported on the challenges and opportunities. In terms of challenges, most of them they're using the hybrid system. Of course, it has challenges during the transfer of data, but also printing costs. There's the existence of systems which are not integrated. Another challenge was to run the paper talks all over the country. And in terms of opportunities, we have the government is ready to in transition to digital health service provision, availability of internal capacity for execute interventions, availability of different partners who are willing to support community interventions. And also, we use the national representative samples to, for VA so as to reduce cost. So going forward, currently we are already we are in the preparation of the survey for understanding the all the mortality surveillance systems in Tanzania. And currently it's submitted to IRB for ethics approval. So maybe we'll get feedback at the end of this week. Thank you very much.
Thank you so much. I appreciate you pulling together these slides. And if you don't mind sharing them with me, I can make sure they're distributed with the rest of the group. If people have any questions, please put them in the chat. I am going to move us along. If you don't mind stopping sharing your slides, I need to put the other slide deck back up, please. And apologies, we're going to go a couple minutes over here, but there's some important information just at the end. Sorry, Maremma, do you mind not closing your slides so I can share my slides?
Yes.
Thank you. Like, Bessie, do you want to speak to your comment in the chat while I pull these up?
Yes, this great ratio we're seeing from countries. I just wanted to mention that as you engage with the stakeholders, it's important to interview them, speak with them, and explain what the SRS is. So that we get the level of enthusiasm. See that.
Yeah, Bessie, you're like coming in really gravelly. I don't know what's happening with your microphone.
Just let you know.
All right, let's see if we'll get back to you in a second. Just real quick though, I think Fred or Emma, do you want to explain to us where we can now find all of our resources?
Hey, Sam. Sure.
Hi, Fred.
Yes, so this link here, I'll put it again in the chat because it's probably way at the beginning. There's downloadable tools, there's PDFs, PowerPoints, documents, Word docs, some Excel. Just to note, as you see, they're in English, and then there's a copy of them under the French link. We have a YouTube site for videos. But that's linked here. You don't have to go directly to the video, to the YouTube. You can get it from this site. and the recording from this meeting will also be added to this site. I assume that's the plan, Sam, is that right?
Yes, that's the plan.
Emma, I don't know if you want to add anything I've missed or
Oh,
we
that's
got
it.
it. Okay.
Great. So yes, we'll continue to update the GitHub. So at this site with all of the tools that we share and as well as the recordings and anything else that people might find helpful. So this will be your one-stop shop for all things SRS planning moving forward. All right, I'm going to move us along. I think we have one more slide just to say that kind of one save the date announcement for sure. I want to make sure you all get, but we are still planning to have our in-person workshop this year. We'll bring together every team as well as technical partners together. Right now, we are asking that you please save the date for the week of June 2nd. You would need to arrive on the location on June 1st and likely stay through the 4th or 5th. We are still finalizing the agenda as well as the location. And so we will share more information on that once we have that available. But for now, please save this week because it'll be really important and I think so enriching for all of us to come together again like we did in Zambia last year, but really sit down and think through how best to support you with your SRS protocols and what the next steps might look like. And again, we're always looking for feedback on what will be most helpful during those meetings. I'm hoping we'll have some sessions on resource mobilization as well as sessions on the technical side and just time to work together as teams. So just putting a plug in for that. There will be technical assistance provided, so please start letting us know if you have requests for particular areas of work. There are going to be a range of types of assistance provided, anywhere from having just a technical call, or there can be in-person, in-country time with staff. So on our next call, we'll likely spend more time discussing what this looks like. But for now, if you do have any requests, please email me and I can help facilitate that. And that I'll say covers, and I'm happy to let others jump on the call here, Daniel or Bessie, if you want to jump in with what other types of services can be provided. We can elaborate on that more, but just to say you're not alone, and we have help if you need it. Our next webinar will be on April 7th. We're going to potentially go over protocol development and resource mobilization, maybe just one of those topics. They're both pretty meaty. And I will be asking other teams to present as well on their experiences on that date. So look out for an email from me with that request, if you don't mind. So with that, I'm going to wrap us up, but I do want to see if anyone has any last minute questions, comments, anything they want to add.
Yes, I do. I can't see where to raise my hand.
Oh, go ahead. You don't need to. You're off.
Yes, yeah, this Williams. Yes, so I think I'm just curious. So listening in, and I looked at some of the tools that have been shared by Dan and then also from Pakistan. The question that keeps coming through my mind is, so the community level structures, what is the plan for the community to be able to understand what happens there? And I'll use Ghana for an example. For where we have the DSS sites, it's well structured. So we have a system where they have community intermediaries that are helping, particularly with case notification and all of that. If you move down south, you don't have that there because the DSS sites do not cut across the entire country. Yet we would need to at some point cover some of these geographies. So the question is, should we also add a component around just understanding what happens, what kind of structures exist within the communities, particularly around case notifications, to be able to make some of these, to make this work more successful and more responsive to what is happening within the communities, or at this point, that is not really necessary. Thank you.
Yeah, it's a really good question, and I first will just start, but I'll ask Daniel or Bessie or anyone else to jump in on this. But I think what we just saw even in the Pakistan presentation, right, is they've looked at how the community informants essentially coming from graveyards, from the ambulatory services, as well as elsewhere, are providing that information in the community. And obviously it varies by setting. But I think not everyone, but I think we are really focused on what's happening at the community level. That's the most important level, right? If we want to make sure that we're getting to those deaths that are unlikely to be captured by the healthcare system. Daniel, and then Igbesi.
Yes. So super important point. I think what you raised, I think the notification of deaths and how do we capture them in the SRS system is one of the key elements that the teams must discuss. Like how it's going to be done. It will not be one size fits all. So it needs to be contextual, and it needs to be like you need to acknowledge not only the cultural practices but also the system that exists, the informal systems that exist in the country. And in the case of Ghana, I do think that is something that needs to be discussed, but also there has been a lot of work done in Ghana already in that realm. So in that area of death notification, how do you get the deaths to be notified, to identify them, and then record them properly to be included in the SRS? I think there's a lot of work that has been done already.
Igbesi?
Yeah, I think just to also echo Daniel's point, that's an important question, but it does not have, for the case of Ghana, for example, it does not have to be limited to the Navrongo. I mean, yes, the answer is yes. You should be looking at the whole landscape for the whole country to understand community identification and reporting of event, and the best strategy to do that effectively across the country. I think Ghana has quite a large experience in community work and diverse experience across the country. It's, those you need to understand them and see how you can leverage them accordingly across the entire country. Thank you.
Thank you, Williams. Hopefully that answered your question.
Yes, absolutely. Thank you very much.
Great. All right, I'm not seeing anything else in the chat.
So
go ahead.
while we're here, I mean, we're way out of time, but what I wanted to mention, I think we often take it for granted that the stakeholders will buy into this quickly and so on. I think what I wanted to mention is that it's important as we engage the stakeholders, you interview them, and you also assess the level of enthusiasm, whether they agree to this, whether they feel like this is something, the SRS is a design or a strategy that they could support or that will be of interest to them. It is so important that their voice is heard and as much as possible integrated in the design of the SRS. That's then when you do that you'll be able to bring them on board. So we'd like to see not all positive stories, but it's also very important to understand where the bottlenecks, the challenges are, so that they can be addressed from the very beginning. Thank you.
Thanks, Igbesi. Yeah, the continued stakeholder engagement is a constant process and will remain important throughout the lifespan of these platforms. Okay, I know we are over time, but I really appreciate the number of you who stayed on past our 1 hour limit here. So I appreciate that. And again, feel free to let us know what other topics you want us to cover, but I really appreciate you all taking the time today to join us live. So we'll meet again next month, and I look forward to speaking with hopefully most of you between now and then. So enjoy your afternoons, your evenings, your mornings for some of us, and we'll all be together again soon. Thank you.
Thank you.
Thank you. Bye.
Bye.
Thank you.
Hey, everyone.
Thank you. Bye-bye.
Thank you. Bye. Bye.